Everybody, my name is Alison Celestine Ferranda, and I did my public health research presentation on asthma. Importance to public health. Asthma is a significant public health issue due to its prevalence to society, and it places burdens on healthcare systems. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to wheezing, shortness of breath, chest tightness, and coughing. Millions of people in the world suffer from asthma that ranges from both children and elderly. It affects 24.8 million people, including 5.5 million children, and accounts for millions of emergency department visits and tens of billions in healthcare costs each year. Numbers and epidemiology. Asthma affects approximately 25 million people in the United States, including 5.1 million children. It's influenced by factors such as increased urbanization, pollution, and lifestyle changes. Mortality rates have decreased due to improved management and awareness, yet disparities are still among racial and ethnic groups. So here's a bar chart that shows the deaths per 1 million adults that are 18 years or older with asthma as the underlying cause done by the National Vital Statistics System in 2020. So the highest shows non-Hispanics, blacks at a staggering 34.9 million deaths. Then comes non-Hispanic whites at 13 million, and the lowest sitting at 2.7 million deaths for non-Hispanic blacks and non-Hispanic whites. There are many disparities across race, ethnicity, sex, and social economic in regards to this chronic lung disease. As previously mentioned, African American people are 30% more likely to have asthma than non-Hispanic whites and are more likely to experience complications, including being 5 times more likely to visit the ER and 3 times more likely to die from asthma-related causes. Boys are more susceptible in having asthma than girls. Children living below or near the poverty level are more likely to have high levels of asthma. Racial and ethnic minority with asthma have lower rates of medication adherence than non-Latino whites. Basically, medical adherence is a patient's extent to take their medications optimally, such as getting prescriptions filled, taking medications on time, and understanding their medication directions. So non-adherence can lead to complications with higher healthcare costs. Potential interventions or solutions to reduce asthma disparities include increasing access to healthcare, improving understanding of the disease processes, and making sure there's proper medical prescription and adherence. Now we're on to the risk factors and determinants. Environmental factors significantly impact asthma prevalence and severity. Air pollution and indoor allergens and poor housing conditions all go into that. Genetic predisposition also plays a role in asthma development, with a family history of asthma or other allergic conditions increasing the risk. So asthma is more likely if other families have asthma. Behavioral factors such as smoking and physical inactivity also increase asthma symptoms, and psychological stress can also worsen asthma by triggering inflammatory responses. Social, political, economic factors, social determinants including house quality and access to healthcare can influence asthma outcomes. Political factors such as policies on environmental regulation and healthcare access also go into that. Economic disparities contribute to unequal access to resources, further creating health inequalities and inequities. There's also proof that certain racial or ethnic groups bear a great deal of the burden of asthma prevalence, morbidity, and exacerbations and abnormal lung function due to racial disparities in social determinants of health, including socioeconomic status, housing, community, environmental exposures, and healthcare access. Last but not least, prevention. There are 3 prevention strategies that I'm going to talk about. There's primary, secondary, and tertiary. Primary prevention focuses on reducing the current onset of asthma through environmental modifications such as health promotion. Some of the strategies include reducing exposure to tobacco smoke and encouraging breastfeeding and promoting healthy air. Secondary prevention aims to detect asthma early and manage it effectively to prevent acute exacerbations. This includes regular screening in at-risk populations and promoting the use of asthma action plans and peak flow meters to monitor lung function. Tertiary prevention focuses on managing existing asthma to prevent complications. There's comprehensive asthma management programs such as those involving patient education, regular follow-up, and medication adherence. An example of a program would be the Asthma and Allergy Foundation of America, or AAFA, which provides resources for managing asthma at this level. Drawing a conclusion, asthma remains a crucial public health challenge due to its prevalence, impact of quality of life, and healthcare burdens. Addressing asthma requires multiple ways to approach that has prevention at all levels. We have to consider interventions, we have to consider various environmental, biological, behavioral, social, political, and economic factors to help solve this. So efforts to reduce these asthma disparities and improve access to care are very important in the long run with this fight against asthma. So thank you very much for listening. This is my reference slide, and thank you for your time.